I'm an ally of the Trauma Center campaign along with other medical students who are standing beside me. And really what we want the university to do is to come to the table and deal with this issue with other medical officials across the city to help address this serious public health and healthcare disparity problem. Last spring, Dean Kenneth Polanski had a public meeting for the community, and in that meeting he publicly stated that he would be willing to work with other officials to make a trauma center a reality on the south side of Chicago. And since then, the university has shown no signs of doing that. And so I just asked the dean and the university to stand up for the values that they talked about, to incoming medical students, and really follow through in that and show some leadership on this issue.
I know that the university's sort of stated line has been that it's really too expensive for them to foot the bill entirely for the trauma center, and I actually believe that that's true. I've talked to a lot of people, ER doctors, trauma surgeons. I've talked to ICU doctors here at the university, including people who were actually here when this place was a trauma center. It really is expensive, but we actually have no idea how much it would cost, and I don't think we've gotten a fair accounting from the university of what their expectation is. Furthermore, how does something like the Affordable Care Act change it, since now more people have insurance? So I'd like to offer up a few different ways that I think the university could think about this issue and find a solution with us. One of the first ones is, I think a big problem that they perceive is that a lot of the trauma victims here are uncompensated. They're not compensated for them because they don't have insurance, or they have very, very poor insurance. And so, the problem is if patients come here and they don't have insurance, the university eats the cost of that care, and that's a lot of money. So I would say that perhaps the university should get behind a solution to that. And I think one possible solution would be the idea of the expansion of a national government insurance program like Medicare to everybody. We call this a single payer system, and there are a couple of bills in both the state and the national legislature towards actually moving towards this. If everybody had insurance, then the university wouldn't lose money for every patient that it cares for on the south side. I think healthcare is a human right, and I think that everybody, even those that live down here, have a right to getting high quality healthcare and not just what they can afford. So that's the first thing I think that the university could get behind. The second thing I think they could get behind is regarding this problem as a real public health problem, that this is a trauma center desert and this is a public health problem. And if that's the case, why not partner with government agencies, the Cook County Department of Health, the Illinois Department of Public Health, the Chicago City the Department of Public Health? Why not partner with them to work on this problem? In rural parts of the state, we have what are known as critical access hospitals, where they get government money in order to stay open, because if they didn't stay open, nobody'd have a hospital to go to. So why can't this be a critical access trauma center where we get support from the government to help keep it open, because otherwise people don't have a place to go to that's safe? My third point for how they could think about this is, as you all probably know, the university wants to get the Obama Library here. They've just initiated a $4.5 billion with a B dollar capital campaign. So it seems to me that if it costs, say, $40 million to open a trauma center, that's less than 1% of a $4.5 billion campaign that they could get from their donors. So I wonder if the university couldn't just come out and ask their donors, hey, what do you guys think about a trauma center? What do you think of supporting that? And for some of the money that we raise to actually go to really support the community on the south side, as well as the students and the staff that work here at the University of Chicago.